every single interview that I ever did at the AIDS Foundation, I asked the question. I told them that we were a sex positive, gay positive organization, and I wanted to know what problems they had with that phrase. And it was not uncommon for me to ask people to leave and tell them they would not be hired at the foundation because of the answers to that question. And it never sunk into me that someone would actually apply for a job at something called the Pierce County AIDS Foundation and have so little interest or awareness or acceptance of the people that would be coming in the door every day. It was started as a program of the local ecumenical organization. It's called Associated Ministries, not unlike the Church Council of Greater Seattle, usually kind of left-leaning church organizations and synagogues that were working on social justice issues. And so the AIDS Foundation started as one of their programs. And so they actually commissioned a series of billboards and bus signs, sides of buses that were funny condom messages. And they were like neon colored condoms. And well, the word condoms wasn't ever used on television. That was one of the words you couldn't ever say on television. Nobody talked about condoms. Condoms were, sex was so secret, that how to manage preventing pregnancies, was almost done in a secret kind of way. And so here we have a disease that's sexually transmitted, and so that they put up these billboards. Well, even today, that firm that did the graphics for that will say that they received a lot of heat. The health department received a lot of heat, and the actual public relations graphics design firm was a very established design firm here in Tacoma, took heat. Dave Purchase was really that instigator, that visionary person who happened to have had a motorcycle accident that almost took his life. But he'd been working in substance use interventions at the time. And he decided that he was a really, really real person. He talked in terms of junkies and, words that the average person in the community was just not really used to talking about junkies, and so he established this whole series of interventions, starting out with his work doing substance use prevention work, but recognizing that these were the people that if we looked at the data from around the little bit of data from the major cities that had already been impacted by AIDS, that he saw that the opportunity, Tacoma, to implement something that could help us become, avoid becoming the next New York City, the next Newark, New Jersey, the next Atlanta, Georgia, the next Vancouver, British Columbia. And so that boldness and the implementation of the syringe exchange program saved countless lives in our community, where other communities like us would have a 60 to 65% positivity rate. We were at 5 to 7% here in Tacoma. So it was exactly at the right time. He took the money that he had been awarded after his motorcycle accident that almost took his own life, and he turned that money into what he bought syringes with. And he took a little television tray table like we had back in the 50s in our homes, and that's where we ate dinner around the newly ensconced TV. And he would take those kinds of tables and set them up on the streets of downtown Tacoma. Who hated him? Everybody hated him. The cops hated him. The business owners hated him. The local community rah-rah people hated him. But he brought most of them around because not only did they trade syringes at the syringe exchange, a clean syringe for a dirty one, but they provided some dignity. They provided some sense of community. By 1997, we started the AIDS Walk in Tacoma. And it was really an out there kind of proposal. There were only a handful of organizations that were doing walkathons at the time. And we wanted to have a big event, but we didn't want it to be we actually couldn't have it on big major streets. I couldn't get insurance to cover it if I did that. There was a great fear on the part of my insurance carrier that we would be attacked, that our volunteers, our walkers would be attacked in some way. Maybe someone would drive a car through our walk or would come with sticks and batter people. And I actually had quite a challenge getting insurance coverage for our event, but we started in a small park, and we went to another small park, and then we came up the waterway, but that was our first AIDS Walk. We also had another program. It was a weirdly different one for us at the AIDS Foundation that involved this kind of topic area, but it was working with women coming out of the prison at Purdy and back into our community. A lot of them stayed in Tacoma because back in those days, you get $40 and goodbye at the door when they finished their term of incarceration. And so a lot of women ended up staying in Tacoma, but we had a contract to come out about 6 months before their release dates. And we had a class that dealt with supposedly HIV prevention, but you can't talk about prevention unless you talk about sex, unless you talk about condoms, unless you talk about negotiation skills. And so that's what we did out at Purdy. And we had that contract for about 4 years before the department thought, well, that's a great program. We can do it ourselves. We don't need to pay this nonprofit to come in and teach this class. So they took it over at Purdy and then stopped the program at Purdy. But unfortunately, it didn't last. But that concept still remains the same as when you're talking with people who've been out of mainstream society for a while about the changes like were happening then. I mean, women could have gone into the prison before really the HIV epidemic hit. And then here they are going back out into this totally different society. It's been, very, very central to my work. And certainly was a defining decision in my life to seek out that position and to work full time on HIV/AIDS issues, and of course learned from people like Dave Purchase and others the real intense obligation you had to carry the torch and to be in people's faces. I used to laugh about my job because I said you get paid to be in people's faces, so I was a burr under the saddle of our public health department when they started to pull back from HIV/AIDS issues, and so have many fond memories of that time.